So she thought you could ask people to civil life, you know? We can agree to disagree on this one, Representative, but I keep one of these.
Sometime in the last 12 hours, I had never so many. It almost looks like a story thing in there or something. Like you help something. I read that there was that's right there by the this is full. This is something 3 years. It was taken 3 years. And it's just the most phenomenal thing. Like if you fall and bruise or something, and this one right there.
I'm going to tell
like you have to take a rag, focus, and put it like under here. And if it's real bad, you can do it you will not have pain, you will be healed, you won't have bruising. It's just helpful. You look at names of you can get it online optimally, and it has there's a place out on YouTube. It's actually from the old nobody uses it because everybody knows have them. It's a God. Yeah, exactly. Yeah, that's what we always look for. This is amazing all the stuff it does. You go online and start researching. It's been used for years and years. These are prehistoric sort of deposits. But we don't have that many. When organic goes with it, they get theirs out of it.
Anybody from Chicago?
And there's actually great fire.
Thank you for coming.
But we do it has to be done. This has to be done 72 hours.
I might. I was maybe. I mean, I could sit down. I can.
Next time you go ahead and order your card. Oh,
Oh, sweet.
No. It's just they kind of they're dealing with somebody trying waiting for your last. I think they just have to.
Tough sell.
That takes me really long. I mean, it does.
I told them I
Thanks. I'll take a look at
Yeah, I was gonna say hard to read. Some of the things that are fighting are just things I just start questioning. It's like, why are we having this fight? Just, you know, should I be with really professional conversation? Really? No, I mean like,
We're going to start in just a few minutes, so if you would please find a place to sit or stand. Thank you all for coming out today. Good afternoon. The Committee on Children and Families will now come to order. Secretary, please call the roll.
Franklin,
Present.
Vice Chair Neely,
Here.
Beard,
Here.
Bratton,
Here.
Brown, Gannon, here, Haefner, Lauer, Meredith, Newman, here, Nor,
Here.
Grimley.
Here.
Quorum is established. So I want to welcome everyone today to the hearing on children and family issues. I want to thank everyone that's come out today for your attendance, and I especially want to thank the committee members. This is a House Committee hearing. The protocol prescribes that members of the committee and witnesses be recognized by the chairman to proceed in testimony or begin witness engagement. So we're going to kind of see who's in the room today so that we can gauge our time. So I want to ask you, how many of those that are here today are in support of the legislation that is being presented? Raise your hands. Okay, all right, thank you for that. And how many are who are going to testify, basically, I should maybe clarify that are in opposition of it? Okay, good, thank you. Now I have another question. Is there any witnesses out there that want to testify that are citizens that are not affiliated with any organization or lobbyists? Is there anyone of that nature? All right, thanks. That helps us set up our logistics. So two of the sponsors are here today, and the way that we're going to do this is that the sponsors are going to present their bills. The next step will be that the committee may engage in questioning or comments of either of the sponsors of the bills. And then we're going to move into the public testimony portion. Okay? I'll guide you through it. I'll take you through it. All right, so we will begin today with Representative Miller, who is bringing House Bill 99. You may proceed with the sir.
Thank you. Good afternoon, Chairwoman, members of the committee. Thank you for allowing me to bring this House bill before you. For the record, I'm Rocky Miller, representative from District 124 of the Lake of the Ozarks area. House Bill 99 is a common sense bill. Currently in Missouri, a custodial parent is notified of every medical action taken on behalf of their minor child, with the exception of one. It takes one custodial parent to allow an abortion to be performed on a minor child in Missouri without any notification to the other parent. This bill will require that both parents must be notified prior to the medical procedure. The intent of this bill is to keep all parents aware of medical procedures being performed on their minor children. In addition, I have added that if for some reason a parent has committed a myriad of offenses, then that parent does not need to be notified. I wrote this bill because I was unaware of a custodial parent could be left out of this monumental decision in Missouri. You see, I was a custodial parent. In addition, my minor child became pregnant. I, however, was notified. In fact, I was notified along with my wife on the day that the appointment for an abortion was made with Planned Parenthood. However, through a short process of gathering as much medical information and other information about the situation she was in, my minor daughter decided to bless us with a grandchild. My daughter is now married and has blessed us with our first grandson and has completed her second degree. I realize my family is blessed. I know that other families are not. However, I feel it is only common sense to notify these caregivers. In previous testimony, we actually had someone from my area that was 15 years old, went in, had an abortion that was allowed by her mother. She then later found out, 3 months later, that her father, if he had known, would have given any sort of support he possibly could. Her statement to us last year was that when she looks at her 3 children, she now realizes there should be a 4th there. It's a very powerful testimony. It goes to the opposite side. If you are not that blessed, what can happen under this situation? In addition, this bill also allows it has a secondary portion that was put in during the process last year that does not allow discrimination by public entities against abortion alternative agencies. Also just a good solid part of the bill. Anyway, thank you. That is my testimony.
Thank you, Representative Miller. Right, we are going to now go to Representative Black. And that will be House Bill 124.
Good afternoon, members of the committee. Appreciate you hearing House Bill 124. This bill was heard on the House floor last year as an amendment, and it passed on the House floor. House Bill 124 is a bill that would enhance what's already in law here in the state of Missouri with the Missouri Informed Consent. Having come from an educational background as a teacher, I understand the different modalities of learning styles that people have, individuals, and I look at who these young women are who go to abortion clinics or parenting type facilities, seeking those answers to the questions that they have when they are met with a questioned pregnancy or an unwanted pregnancy, or possibly seeking alternatives to abortion. A lot of those individuals are given, by law, they're given a packet of information that has the gestation of the child. It's all spelled out in state statute in section 188. But there is nothing there that addresses those individuals who may not understand the information in printed form that they're given, or those individuals who may be blind and don't have that information that is only in printed form, in Braille form. And so to try to make sure that, one, we come into the 21st century with technology and allow that information to be on video, we also address those other possible handicaps that people may have in interpreting and understanding the information. So House Bill 124 would require that the Department of Social Services produce a video that would be also administered and given in the facility setting by the physician. Same with the informed consent packet. And the video would be a narrative documentary that has everything in section 188. And there's a long list of things that are required to be given to a woman, and you can read those in the bill. And it would be a mirror image of the printed form, but only in a narrative documentary form, so that those individuals clearly understand the decision that they're making. And the fiscal note on there is presented in the fact if each individual woman is given the printed or the video to take home with them. That's not necessary. That fiscal note could be reduced greatly because it could be viewed in the doctor's office or the clinic, and only one copy or a couple copies would be necessary for that clinic setting. So with that, I think this is just a way to enhance what we already have in state statute. It clearly brings the technology to the issue at hand. It also addresses those individuals with different learning styles or illiteracy and may not be able to read that printed information, which is currently not addressed in state statute. Thank you.
Thank you very much. And now we'll go to Representative Anderson, and that would be House Bill 81.
Thank you, Chairwoman and committee members. My name is Representative Sonia Anderson. I represent the 131st District, which is in the Springfield area. I am presenting today House Bill 81, which is also known as the Parental Involvement Enhancement Act. And I will say that every provision in this bill is designed to better protect the health of the pregnant minor, the unborn child, and parental rights. I would also like to say this bill language is identical to last year's Bill 1845. It did pass out of committee, but it never made it to the floor. What this bill mainly does is strengthens Missouri's parental consent law when a minor, someone who under the age of 17 and under, is wanting to seek an abortion. Right now, under law, you are required to have parental consent to have an abortion. But what this does is you need to prove the identity of the parent or guardian to make sure that that's who they say they are. So you're requiring a notarized signature to make sure that they are indeed the parent or the guardian. This also requires that in the case of a medical emergency, they may still go ahead and proceed to have an abortion, but within 24 hours, it is required that the physician does contact the parent or guardian to let the parent or their guardian to be made aware. They may seek a judicial bypass, but they may be required to seek that bypass in the county that they reside. What this bill also does is there's a list on the consent form of serious complications that may happen in result of an abortion. And so the minor and the parent must check off that they understand the risks that are involved. So that's mainly the gist of the bill, and we're happy to answer any questions.
Thank you, Representative Anderson. All right. Good job gathering. Thank you. Now we're going to move to committee members. So committee members, I will recognize you for questions or comments. Please indicate which representative that you are asking the question of, and we may proceed. Are there questions from the committee? Representative Bratton.
Briefly inquired of Representative Black. We did pass, I apologize. With the video that we did pass that as an amendment, what was the opposition one? Did it get stuck in the Senate? What happened with that?
At the late hour that the amendment was put on to the 72-hour bill, it was not something that the senator handling the bill. He wanted to keep only the 72-hour component of that, and he wouldn't have allowed any other amendments. It was something that he had already decided before the amendment was put on, and wanted to keep it just the 72-hour component. And since that time, I've had a discussion with that senator, and he, in retrospect, wish he would have just left it on there and traveled through the process, but it made it law already.
Thank you.
Any questions, please? Representative Newman.
To inquire, Madam Chair.
You may.
Good afternoon. I guess my question is both for Representative Miller and Anderson. Are you familiar, I guess most specifically, let me start with Representative Miller. Are you aware that there are not perfect families in the state that don't have two parents that you can notify safely?
Yes, therefore, part of this bill has a myriad of things that go to that particular question and saying, if this happens, if this happens, if this happens. I believe there's a total of 20 items that can discount the other parent from having to be notified.
And I kind of looked at some of those exemptions that you mentioned, and I think most of them are dealing with basically if you're a parent and already convicted of various domestic violence or sexual predator offenses, or if you are under an order of protection. So here's my next question. If you cannot safely go to one of your parents who does not fall within those exemptions, then what choice do you have?
You actually have already currently in law that you can go before a judge and you can get an abortion via that method.
Okay, so if you are a minor, you would have to basically address the judiciary process to be able to still go through one of the rights that you do have.
Which is not addressed by this law because this is strictly a notification law, not a consent law. So this changes nothing as it pertains to that.
Correct, but I'm saying in terms of one of those exemptions or one of those things in terms of your response, in terms of why you could not go to both of your parents, you said that that's already addressed in another statute.
Right, correct. And you don't have to go to both. You just have to, the other parent has to get written notification. It has to get notification of the other parent.
Well, what I want to point out is that we do not have complete ideal families in the state, and we do have two-parent families or guardians who would not fit under those exemptions that would still make it dangerous for a teen to notify. We've had all kinds of situations where the minor's life would be in jeopardy, and I think these exemptions do not cover every family that's not a perfect normal family.
I'm going to have to disagree because I think that at the very end it gives a kind of a catch-all portion of it. If there's a whiff of impropriety on this, the other parent does not have to notify. So therefore, the safety of the minor child in those particular cases is important. The other part is you have to start weighing things. You have to start deciding what's more important, the life of the unborn child or a hard discussion about things. And that's where we're getting into with this particular. I realize that not every family is perfect and that you will have discussions. You may have arguments. Those things must be weighed against the life of the unborn child.
So you, Representative, you did point out that there's things that we have to weigh. When you say we, I think you're referencing state government. This is the body that we are today. That we have to weigh state government, the life of a fetus versus the life of a pregnant woman, correct?
No, you are incorrect. I'm talking about the life of an unborn child versus an argument.
Which could very well be threatening to you as a pregnant woman if you were a minor?
Walking down the street could be threatening to you as a minor.
I think you'd kind of let your opinion be known here, Representative, and I want to say that I strongly disagree because I know that there are not perfect families in this state. I know that there are not perfect families that can have both of their parents or guardians notified of all kinds of decisions, let alone becoming pregnant, knowing that your family would not support you. So I believe that this is designed to actually shame a minor and put them in more jeopardy. And I think we'll be hearing from other testimony that that's true. Thank you.
Thank you.
Committee questions? Representative Beard. You may.
You understand that? Representative Miller, my question, I'm looking at this and it says that the consenting parent will give written notification to the other parent. I'm trying to flesh that out. What is that, like by mail, hand delivery?
You know, we talked about this last year. This bill actually made it off the House floor with bipartisan support and on into the Senate. And the question was, what is notification? And that's your question. And the thing is, notification is a well-documented legal principle. And so to continue and describe what notification should be or looks like would be superfluous, would be additional, something that's already there and we're already supposed to know what it is. However, to be quite honest, I kind of wanted it in here, but I was told it was a good idea to keep it out.
What did you have in mind as far as your notification?
I would like to have written notification or at least, very least, documentable verbal notification. Again, I'm an engineer, not an attorney.
That's all.
Other committee questions? Representative Meredith, thank you.
Permission to inquire. Okay. First of all, I'd like to ask Representative Black, here you are. In the video that you're talking about, is this just someone standing there talking? Is that what you're, and telling people about procedure?
In state statute currently, in the Missouri informed consent, as you can clearly see that's already in the bill before you, there are requirements such as the gestation of the child. There are requirements such as alternatives to abortion. There are requirements such as injury or threat to the life of the mother that are required in there. So no, those are required to be visual.
So is this someone just standing there presenting it to them on film? What is, I want to know precisely what you want in the film.
Okay, in the documentary or narrative, it would be exactly what is in the Missouri informed consent right now in printed form. Those would be narrative as far as the gestation of the child, the procedures, the possible medical or health risk to the mother, the pain or injury to the fetus that's described within the Missouri informed consent already. Those would all be required to be conveyed in a video format, which would be just basically a documentary or narrative. It would be orchestrated by a physician, and the Department of Health and Senior Services would be responsible for the production of that video. They would be responsible for acquiring the video information that shows the gestation. They would be required for.
What do you mean shows gestation?
In the Missouri informed consent right now, as you're well aware, you have to show the gestation of the child at certain weeks.
Are these pictures?
In the Missouri informed consent right now, yes, they currently already are. Yes,
Okay.
it's in the bill.
Do you think, I mean, because this is an invasive procedure. Do you think that there are other procedures, medical procedures that people have that also, maybe they should know before they, say, have a hip transplant or a bypass surgery, that they should have that same kind of information for them also?
It's my understanding that many physicians do also provide that in a narrative or video through whatever company provides those types of apparatus or devices that they're going to be putting in there. But to speak to that, which is not the nature of the bill today, I can't answer questions to that particular issue.
My thinking is that if we show pictures of various procedures, we should include more than just one. Okay. Moving on to Representative Anderson, I would like to know, you're talking about proof of identity that someone is someone else's parent. How do you do that?
I would say a birth certificate.
I could use any birth certificate. You know, I could take anybody's birth certificate.
You would have to have proof identification, like say a driver's license that gives your name ID, and then something like a birth certificate would show your proof of relationship to the child. Or if you were adopted, your adoption.
My children do not have the same last name I do. Their birth certificate says that has a different name for me than I carry now.
I'm sure you have.
So would I have to go in and take divorce papers and court orders and all this kind of stuff to say I'm this kid's parent? How do you do that?
Well, if you had to do it with your changing your social security name on your social security card.
But if I am in a situation, your divorce is what?
We're not talking about a divorce, we're talking about.
No, but if your name on the birth certificate is not the same as your child who is seeking to have an abortion, I don't know of any way that you could for sure identify that unless you did DNA tests.
I don't think so. I mean, people notarize their identity all the time.
It's just taking someone's word. Okay. I guess if you think that's sufficient, well, all right. And Representative Miller, I want to thank you because you included an emergency clause. It's been missing. And I think that's great. I'm glad that you put that in there. And I really do appreciate that because there are emergencies. And to have a situation that's an emergency and have to run around and do all these other things, it could, get way beyond control. I like that. However, there are times, my problem with your bill is that there are times when someone is not a registered sexual offender. Somebody is not on the record as being a dangerous person because, well, maybe they haven't been caught yet. But as far as that pregnant woman, young woman is concerned, she could have a parent who is very physically abusive and frightens her, seriously frightens her. I work with children who have been abused and neglected. And there are people that literally scare them into panic, serious panic. And while that person may not have been officially accused, they're very dangerous as far as that young woman could be concerned. And if that person happens to be her father, to get his permission or to let him know could put her in a very precarious position. And I do like the emergency clause, and I want to let you know that. Okay? Thank you.
Representative Brown.
To inquire of Representative Miller. Thank you. When it comes to other type of procedures and things like that as a parent you have to give permission or be notified, what are some of the other things that nobody has any beef about? Could you name a few? I know as a parent of 5, I'm notified by a lot. I'm just to administer aspirin or anything within the school district, I've got to give consent and be notified. Do you know of any? What are some other?
Well, I believe it's a standard parental rights that you come out of a divorce with because in addition to that child being minor, my family was less than perfect. She was child of a divorce. My ex-wife notified me that we were about to have a grandchild. So on that, and in that parental plan that was certified by the court, it had every major medical thing I was to be notified of. And in fact, with that kind of stuff, I was to give consent. And so as a true parent of a child, it was important enough, at least by the courts, that I should be notified and give consent of things that would affect my child. It is my child.
Your grandchild.
And now my grandchild. And of many now.
Well, gentlemen, I think the gravity of what you're trying to push, there are about, I think statistically, 68,000 women die at the hands of an abortion procedure. That's double that for the unborn child that's life is taken as well. And I think as a parent, we have an obligation to ensure their health is factored in and make sure that they're making a real adult decision in what this procedure is. And to Representative Black's was just a question about the type of procedure. It's not a hip replacement. I mean, this is 23 chromosomes from another individual and 23 from another to come together to form its own unique DNA. This is a living being. This isn't a hip or a piece of tumor that's being removed in this type of procedure. So I commend all three of you for standing up for parental rights and for such a heavy decision that's unfortunately legal in this state. Thank you.
All right, are there other committee questions?
Inquire.
You may.
Representative Miller, are there any penalties for violating the section 188, 1028?
No, there currently is no penalties written in the law. It's just a requirement of law that it happen.
Okay. So if the statute's not followed, what happens? It's pretty severe. Anything else?
Well, you can sue, as in other requirements of law, of which there are no penalties. There's an injured party, which in this case would be the non-notified parent, would have action under law.
Yeah, thanks.
My best lawyer
Representative Norm.
Thank you, Representative Miller. You made a statement about someone will die. I believe that'll happen regardless of whether your statute is put in effect or not in some cases. That's the only comment I wanted to make. Thank you.
Any other questions, comments from the committee? All right, I want to thank the bill sponsors. We're going to move to public testimony at this time. So y'all may move away. Okay. We're going to move to the folks who are just citizens that have come to the Capitol. We really appreciate you coming and taking part in the government process. So I have to let you know that all witnesses are required to fill out a witness form, which is available at the desk. And in the interest of time, we will set a time limit for each one of the witnesses. And if you find that your viewpoint, what you have to say, has already been expressed, you are certainly welcome to fill out a witness form and stand at the mic and say, I agree with the previous witnesses. If you feel you have something that's additional to add that the committee has not heard yet, then please express that to us. So I want to start with those that support of either of the three bills. And those that have come from out of town, quite a ways away. So is there anyone in support? Citizen witness, please. Okay, let's see. How much time? So we're getting set here. We're going to time you at 2 minutes. All right? All right. Thank you so much.
My name is Joanne Schrader. I am here on behalf of myself. I live in Boulder, Missouri. I am in support of all three bills. The green light's on.
Okay, pull it a little closer to you.
I'll start over. Is that better?
That's good.
Okay. My name is Joanne Schrader. Oh, now it's on. My name is Joanne Schrader, and I am here in support of all three bills. And one thing I wanted to point out, this morning I went to the dentist and had my 6-month checkup and routine cleaning. They verified my identity, even took my picture with a webcam for purposes against insurance fraud. So if my dentist can do that, then why not verify the identity of the parent who is giving consent for a surgical procedure or medical procedure for his or her minor child? There have been instances in the country where a soccer coach, a boyfriend, has posed as the person able to give legal consent for their sexual abuse victim, and she has gone through with the abortion, and the parent has found out later and had to take recourse against the facility in Denver, Colorado, or Ohio. I've written out most of my testimony here, so I think I'll just go ahead and submit what I want to say in written form. Thank you very much.
All right, thank you. Let me see if there's any questions from the committee for you. Are there questions from the committee? Thank you so much. All right, are there others in support now that are citizen witnesses? Any others? Okay. All right, we're going to move then to those citizens that are in opposition of any of the bills. So please come forward. You'll need to fill out a witness form, state the bill or bills that you are in opposition of. Please come forward.
Good morning. My name is Dr. Colleen McNicholas. I'm an assistant professor of obstetrics and gynecology at Washington University School of Medicine in St. Louis and a fellow of the American College of Obstetrics and Gynecology. I'm here to testify in opposition to all three of the bills. I'll speak first to House Bill 124. So, as all of you are well aware and we've heard, women accessing abortion care here in Missouri already undergo a very specific and detailed consenting process, which includes nearly every item in this bill, including the opportunity to see and hear the heartbeat of their fetus, the 22-page state-developed booklet detailing fetal development, and information on alternatives to abortion, among many others. This makes me pose just one question. Why do we need yet another way of delivering this information? Is it that the representative can't actually believe that despite all of the tactics that the legislator has already enacted to sway a woman's decision away from abortion, they still choose pregnancy termination because it's what's right and moral for them and their family? As physicians, we're taught every interaction with the patient must be done so within the framework and the tenets of medical ethics: autonomy, beneficence, non-maleficence, and justice. I realize that as legislators, and not physicians, at least for most of you, that you may not be aware of such tenets and how they're applied to clinical medicine in the doctor-patient relationship. However, I also feel that if you're choosing to legislate a field that you have not been trained in or don't practice in, that it is your duty to evaluate the impact of such legislation on those who do. For example, the existence of such mandated state-designed consenting procedures, be it in writing or video, that includes medically inaccurate information, violates the principles of medical ethics. Legislation such as this requires physicians to lie to their patients. Lastly, I'd like to highlight a point which we may agree on. Line 135 mentions the importance of the consenting process and that it focuses on the individual circumstances of the patient. I couldn't agree with this more. The problem, however, is that by definition, standardized counseling ignores the individualization and personalization of medical care. What you propose is that every woman hear and see the same exact information, and this is as far from individualized counseling as I could
I'm
imagine.
so sorry, but your time is up. Would you like to submit that as written testimony?
Absolutely, I will submit that as well as testimony on the other pieces of legislation.
Thank you so much. Are there questions from the committee? Representative Lauer,
To inquire.
you may.
Thank you. Doctor, you just made a statement that one particular event would cause a doctor to lie to the patient.
The information in the state mandated booklet, there is medically inaccurate information in that booklet. And so every time I present that to a patient, I am lying to the
What
patient.
specifically is that?
First of all, the fact that the life begins at conception is not a medical definition. In order to actually be pregnant requires implantation. The second is that all of the information on fetal pain, and certainly I don't have enough time to go into that, but I will reference you to the Journal of American Medical Association, which is the most premier medical literature source that we have in our field, which gives a very detailed explanation of why fetal pain at this gestational age is actually not capable.
Okay, so your definition of lying to the patient is based on your belief system.
No, my definition of lying is based on medicine and science. There's a medical definition of pregnancy, which includes and requires implantation.
Which is a belief system. Thank you.
Science is not a belief system.
Please keep your reactions to yourself, okay? Everybody, in here has, the committee members are here charged with the job to ask questions, to vet the witnesses. So keep your responses within yourself. Thank you so much. Representative Neely.
To inquire, Madam Chair.
You may.
Doctor, thank you very much for being here. I think that you represent something that is obviously lacking in our legislature, that we're mandating some medical procedures or policies that you must follow as a physician without having complete knowledge of what that entails in terms of what you need to do in your own responsibilities. You weren't able to testify on the other two bills, but are there some medical ethics also involved in terms of the parental notification legislation we're considering?
Absolutely, I can, and it's not a rare instance actually that we encounter young women, minors that cannot and will not inform their parents. I think it's also important to point out that proponents of this legislation have no difficulty in accepting a minor's ability to make a decision to parent a child. It's only when they decide that they're not ready for that responsibility that we start to question their maturity and their ability to do so. And in fact, there are many medical procedures that minors can consent for without their parents' consent. All sexually transmitted infection testing and treatment, contraceptive education and implementation of such are two examples of where minors can access care without parental consent.
And have there been situations that you have seen that would actually endanger that minor pregnant woman if they were forced to actually notify both parents?
Absolutely. In the 8 years that I've been practicing obstetrics and gynecology in Missouri, there have been at least one a year young minor that we had to help get through the judicial bypass system because of those such issues. There are a variety of reasons. One is estrangement. They were essentially abandoned by their parents or had very limited contact with their parents. Several others had to do with abuse. One was out of fear because the pregnancy was actually a result of a relationship with the mother's boyfriend. And so there are a variety of reasons that people can't do that.
And those reasons can't all, and they're not all actually listed as exemptions in this legislation, are they?
They are not. And actually, if I've learned anything in medicine, it's that you can't actually predict any one thing about any particular case, be it an abortion case, an obstetric case, a gynecologic case, or a hip replacement. Everybody is different, and medicine really needs to be individualized on that basis.
So what we're doing with basically all three of these bills today is mandating what you as part of the medical community must do. And yet you mentioned too what happens with your own medical ethics. So here we are as members who are not OBGYNs that have no background, yet mandating and putting actually your own profession and your own job at risk. Can you explain further in terms of what now does that do with your own practice?
Well, it's certainly a frustrating experience to have to tell somebody something that you know is not medically true. The representative cited there's 65,000 deaths from abortion. In fact, the risk of dying is more than tenfold higher if you continue a pregnancy. And so you can throw out whatever statistic you want, but it has to be within the framework of reality, which is that, yes, there are risks of abortion, but there are risks of continuing a pregnancy. There are risks to everything we do. And so all of those pieces of information need to be individualized and put in the context of reality.
And the other, in your care in terms of women of all ages, aren't you bound by your medical community in terms of where you pull out your information, the information that you actually deal with? Is it your own personal beliefs, or is it religious beliefs, or is it medical standards that you are compelled to follow?
Yeah, so that's a great question. So the sort of practices of obstetrics and gynecology are guided by the American College of Obstetrics and Gynecology, and to some degree the American Academy of Pediatrics, both who have had formal and very outspoken objections to these types of legislation. In terms of medical ethics, that is something that's taught to you from the time that you start medical school. And the idea of delivering evidence-based medicine is always put in front of your own beliefs. For example, if a woman comes to the hospital, is transferred after having a full-term delivery, having nearly bled to death, refusing a blood transfusion because she's a Jehovah's Witness, then she does not get a blood transfusion, because it's not what I think that she should have, it's what she thinks she should have.
So therefore, your own profession is in jeopardy by state mandating procedures that, number one, are not recognized as being medically accurate, and then two, putting your patient's life in danger because of someone else's religious beliefs. So in terms of how we want to legislate more restrictions on legal abortion, what we're doing in terms of that consequence is putting that patient under your care, and both of you actually in jeopardy.
Absolutely.
And what would happen to your medical license if you were to not follow these things and yet you're in conflict with your own medical standards?
Yeah, so it's a great question. I don't know. So what happens now is we deliver state mandated information, and then we deliver what we know is to be the medically accurate information.
So right now you have to present both.
Correct.
And you're mandated that also by your own medical standards?
That's correct.
And if you were not to present that, then what?
Well, I think that would be malpractice to not actually present the true medical risks of the procedure.
So when you bring a malpractice, you are then legally liable for not presenting medical information that your own board, your own license would require.
That's right.
So we are putting basically your profession in jeopardy with this legislation.
Yes.
And yet it's a profession that we, I would say the majority of women in the state depend on for our reproductive health.
That's right.
Thank you, Doctor.
You're welcome.
Other questions for this witness? Representative Brett.
Madam Chair. Good afternoon. How are you, ladies?
I'm great. Thank you.
Good. Now, you brought up scientific facts. Now, when a sperm and an egg meet, do they combine and become a new DNA? Is it a new strain of,
Sometimes combine, yes.
well, whenever
Mostly they don't.
whenever
Okay, combine.
there's fertilization of the egg, every time it intertwines a new genetic code every time,
It
right?
begins that process, yes.
So it would be its own genetic code, and it would stick with that being, just like you, when you were a fertilized egg, your genetic code began at that very moment, correct?
Correct.
Okay, so that would be the beginning, scientifically, of a new form of life. Now it had to move to implant to become and host off the mother in order to grow into a human being. But at that time, that genetic code became its individual genetic code at that particular time. Scientifically correct.
There is unique.
Yes or no?
There is unique genetic material. However, tumors also have unique genetic material, and we remove them all the
If you
time.
DNA test a tumor, it is your specific DNA. It is not
If I
foreign
DNA test a ovum, it is partly my DNA.
It's partly your DNA.
Correct.
So it's someone else's DNA, where if you were to DNA test a human being, it would be your mother's and your father's combination of DNA.
I am really confused at where you're going.
You're really confused.
Yes,
That's
so,
a genetic
so I
process
think
of
what you
23
want me to say
chromosomes.
is that the beginning of life is at conception, and I will not say that because that is not a medical definition. Pregnancy
Whether
requires
medical, we're talking about
implantation.
scientific fact, and it's at that joining of the genetics of from two different individuals coming together to
Yes,
become one.
yes, when a sperm and an egg meet, there is exchange of genetic material.
And it becomes its own genetic material at that point.
Yes.
Correct. So that would be, and that's the building block of life as
It may be a building block, but it's not life until it's implanted into the uterus.
it is life, because it's two cells that are now living together.
So let me ask you this. Should we be legislating against masturbation because it spills out 3 million sperm every time?
Well, there's
Because that is a building block of life.
no, there's no,
It's not?
there's no fertilized egg, there's no.
So you're deciding what you think is the beginning of life. So I'm just extending your thought process one step further.
No, because it becomes its own DNA at that.
We won't agree.
Okay, but let's move on. A child, say, is going for cancer treatment, hates that treatment and refuses to go. Should it be that parent's responsibility to step in and say, this is really, we believe this is what's best to save your life and to ensure that your quality of life is better?
I think it depends. I think that's why
So
there's ethic boards.
a small child should have that decision.
Well, how small is small? 16? Is 16 too young?
Well, how young is too young for you for parental consent of an abortion?
We already have parental consent. That's
But
not
I'm
what's at
saying,
issue here.
You understand what I'm saying, but requiring that a parent have that say so. And both parents within that if one parent decides they don't want to go through, say, cancer treatment of a child, should that other parent have that say in the cancer treatment?
So I am not aware right now that there are any pieces of legislation or rules in medical ethics
Well,
that
you're
both
talking about
parents need
medical
to agree
ethics here.
that need to agree on any treatment other than this proposed legislation. If I brought my son to the emergency room, they are not going to call his other parent if I consent.
But if it had to do with a life-ending procedure,
No, they wouldn't. If I, as his parent, give consent, that is enough.
well, I disagree, and I think that's exactly what this
Okay.
bill does, is that in order to save a life, that's what this bill does. It ensures that both parents have that say, or at least would have the option to.
So what you're saying is the intent of the bill is to save someone's life. Whose life are we saving? I thought the intent of the bill was to make sure that both parents were involved in the decision.
Just like the medical fact that women do die during an abortion procedure, it could be saving that child's life in that, but it's also saving that grandchild's life.
So I can tell you we have had no abortion-related deaths this year. We have had at least 5 maternal obstetric-related deaths. So
One's too many.
I agree. 1 is too many. Those were obstetric-related, carrying their pregnancy, wanting their pregnancy deaths. 1 is too many.
Well, but there are deaths that are associated with an abortion procedure.
Okay.
So,
There could be.
well, absolutely. Thank you.
Lady.
All right. Thank you so much for your testimony
Thank
and answering our questions. Thank you. Do we have any other citizen witnesses that are not affiliated with any organizations or lobbyists?
I think we do.
Yeah.
So my name is Betty, and I'm with Planned Parenthood, and I think we've had a number of people prepared to testify after we framed this, and so I'm fine if you want to take a lobbyist in an opposition, but the folks we brought were expecting to follow the organizational framing, so if it's at all possible, I'd like to be able just to put my witness stuff in, ask my colleagues from NARAM, the ACLU to put in, and then we'll be quick, and then we'll get to the citizens if that's at all possible. And again, I'm okay if you want to go to the opposition lobbyist.
Well, thank you so much for your input. We're going to stay with the citizens who are in opposition right now. Thank you so much. Are there any citizens in opposition that would like to speak? All right, please. Remember that we have, citizens have 2 minutes.
Okay, hi, my name is Jennifer Bernstein, and I'm a social worker from St. Louis, Missouri. I worked in sexual abuse prevention for 10 years. Just to give you a couple of statistics, 1 in 4 girls is sexually abused in his or her lifetime. Only a few of these are reported because there are so many reasons that people do not report sexual abuse. And 93% of the perpetrators are someone the child knows. This is evidence-based facts. Let's say you have a child who is being sexually assaulted by her father and she gets pregnant and she has to inform both parents. How would that make anyone feel? It's absolutely deplorable, and as someone who has worked with these kids, it makes me really physically ill to think that someone is going to have to get consent from their rapist to obtain a safe and legal medical procedure. Thank you.
All right, thank you so much. Are there any questions of this witness? From the committee? Okay, thank you. Representative Bratton has a clarification to make, and I think it is if you're not in this world where we refer to one another as lady or gentleman, you might misunderstand, and he wants to make that clarification.
I was not being disrespectful. Everybody seemed to be aghast that I was saying lady. That is proper procedure when we're conversating between, so that's actually proper decorum for me to refer to you as lady. So if it came across that I was being disrespectful, that is our proper procedure of addressing everyone. So,
thank you. Other citizen witnesses in opposition, please come forward.
Hi, my name is Ellen Demscher. I'd like to speak in opposition to House Bill 124. About 2 years ago, I became pregnant. And at first I did intend on having a baby. I decided for a variety of reasons. For one, I was working part-time, not getting paid enough. 2, my parents were not supportive. 3, the man I had conceived with was not responsible. I could not count on him to help me. So for many reasons, I went to Planned Parenthood. At that point, I was not seeking more options. I was seeking an abortion. And I was very hurt. I was very offended by the wealth of material I was forced over. To imply that I did not clearly understand that wealth of material, to imply that I need a video to go along with it, to imply that I need an enhanced presentation is really an insult to my intelligence. And it was that wealth of propaganda I was forced to look over that made that day so hard. Thanks to Planned Parenthood, I was able to have a safe and legal abortion, and I'm very glad I did. I have said it before and I'll say it again, having unprotected sex was one of the worst choices I've made in my life. Having an abortion was one of the best.
All right, thank you so much for your testimony. Are there any questions from the committee? Representative Newman.
Inquire, Madam Chair. Ellen, thank you so much for being here, being willing to share your story with us.
Thank you.
As we know, and you know, you're not alone in terms of there are many other young women in your same shoes. And I agree with you that further restrictions, further mandates that you must undergo as a woman seeking a legal abortion is an intelligence. Did you feel shamed by this? The fact that your personal private decision basically had to be affected by what the legislature tells you that you must do?
Absolutely. I felt like it was an attack on my ego, almost.
That your decision would be an opposed to maybe personal, private decisions that any legislature might make in their own personal family situations, but that yet that belief system was mandated through state government to further interfere with your own private decision.
Right. Like I said, I intended on carrying the pregnancy to term at first. I went through a lot. I made a big decision and I thought a lot about it. And it just hurts me to realize that there are people out there who distrust my ability to make my own choices, to distrust young women like me in that decision-making process.
And would you say that decision is probably very serious, very thought out? You have referenced different points in terms of how you made that decision based on you, your own ability, your own finances, your education, your family, and partner support. Are there other women like you?
Absolutely. I think I speak for a lot of women when I say that if I could have raised a child at that point, I would have. The fact is, I couldn't have. And while adoption is a word thrown around a lot, there are also countless children stuck in the foster care system. So I don't feel like that's an easy solution either.
We want to thank you. I mean, I know it's hard. And I know it's hard to talk about your own personal story because, you know, that you have to go through that again, and you have to go through that publicly, and you have to go through that publicly with shame by people who don't agree with either your decision that was based on your own personal, private background. If you were a minor at the time, and I'm not asking you how old you were when you made this decision, but if you were a minor, would there be other obstacles that you would have had to gone through?
Absolutely. As we've talked about, it's a lot harder for a minor to go through that process. And I think adding more roadblocks between minors and the decision they make, I think adding more roadblocks is only making things harder for those minors, for those young women.
Thank you very much for being here.
Thank you so much. Are there any other, thank you for your testimony. Are there any other citizen witnesses? Thank you. I do want to make an announcement. We did have scheduled Tim Decker from DSS, Children and Families Division, the director, and because of the amount of testimony that we have today on these bills, he is elected. We're going to move him to next week. So if you were here to hear Director Decker, he will not be presenting to the committee today. Right, thank you. 2 minutes, thank you.
Hi, my name is Dr. Shelby Cluis. I'm originally from St. Charles County, Missouri, and I'm currently a fourth-year resident physician at Washington University School of Medicine. I would like to share with you my experiences of my patients and why I feel House Bill 124 is dangerous and inappropriate for women of Missouri. I recently cared for an affluent woman who underwent a termination for a pregnancy complicated by a congenital abnormality that is associated with many complications, ending ultimately in death. Not only did she have to go emotional turmoil in making the decision to undergo a termination, she was then tortured by the 72-hour waiting period and kindly asked me where the elected officials were during that time period to console her, given they were the individuals who made her wait the 72 hours after signing the consents. Not only have we limited access to professional medical care with our abortion provisions, House Bill 124 would like to further our emotional torture by requiring state-scripted counseling and medically inaccurate information to try to change her mind. as if her initial decision-making thought process, which brought her to make that decision, couldn't be trusted enough. This is the only medical procedure performed by physicians who have been trained for a minimum of 11 years that is held to a different standard in the consent process by individuals who had no training in abortion care. Elements of a valid informed consent include disclosure, capacity, and voluntariness. Voluntariness is exercised without coercion, manipulation, or undue influence. It is blatantly obvious that requiring a state-scripted, medically inaccurate video during the consent process for abortion is not valid informed consent because it defies that principle by coercing the patient, manipulating the patient, and providing undue influence on a patient to make a different decision than she has already made. This is contradictory to the informed consent process and wouldn't be acceptable in the consent process for any other medical procedure.
You were perfect. Thank you so much.
My voice wasn't though.
Well, I hope you're not ill. So we have a time frame, committee members. If you have questions that you have not asked before or points that you have not made before, we welcome those if you think about that before you are asked to be recognized. So is there any committee members that would like to be recognized for questions? Representative Neely.
To inquire, Madam Chair.
You may.
Thank you, Doctor, for being here, and of course, given your medical background, particularly as we, consider this legislation. Do you have other patients that you predict, even in the future, would fall in the same category as the patient that you described, and for the reasons that they were seeking an abortion, and how they would be affected, even how your future practice would be affected by this?
Yes, every month there's always somebody new, and more so for the providers at Planned Parenthood. There's always a patient that falls into this jurisdiction in which they're tortured by the 72-hour waiting period, but then also the extensive informed consent process. Regardless of who they are, where they came from, or why they are seeking an abortion, it's always a concept of contention amongst that person.
Thank you.
Representative Brimley.
To inquire.
You may.
I noticed you said something inaccurate. So you're saying that the video will be inaccurate?
If it's based upon the booklet that is given to patients now, as previously discussed by Dr. McNicholas, there is medically inaccurate information. I don't know what that video is since it's not, I haven't been able to view the video, but if it's anything like the booklet, there is medically inaccurate information, yes, as we've discussed previously.
I would think that the video would have to be accurate, but to make a statement that it is inaccurate at this time, of course, it's made.
Well, I would also hope that the packet that's given to patients is medically accurate when in fact it's not currently, and that's supported by the state as well.
I've worked with children and families for many years, 36 years actually.
A long time.
2 ministries.
Mm-hmm.
I've also talked to a woman that had an abortion,
Mm-hmm.
and it affected her life terribly. And she said, they didn't tell me. She contacted Planned Parenthood as well.
Mm-hmm.
I would tell you that
They didn't tell her what? I'm sorry.
She lives with that every day.
They didn't tell her what? I'm sorry.
That's what she screamed to me on the phone when she was crying about her abortion. She said they didn't tell me, so I didn't go into asking her what they didn't tell her. But I'm just telling you that some people don't, And if I would talk to her today, that's been years ago.
Uh-huh.
And I'm wondering if that 72-hour would change her mind too. So, we can probably get stories on.
I'm sure we could. Mm-hmm. Just like with any medical procedure, we have to consent patients and inform them, just like we do extracting a tooth, incising an infected wound, changing bandages on an infection or a broken bone, etc. The list goes on and on. I just think it's important that we need to treat abortion care just as we would any of those other medical procedures.
All right, thank you so much. How are you today?
Thank you. Hello, my name is Charles Becker, and I'm from the southwest part of Missouri, and I would like to represent minors in this case. Being from a very small community, I know that close-knit high schools have a lot of unwanted teen pregnancies that end up happening and affect everyone in the community when they do happen. And knowing friends and peers that have gone through difficult situations with unwanted pregnancy and sexual abuse, it's very difficult to see how legislature interrupts their decision to make a future for themselves, where it's very difficult as it is already. So when thinking about abortion in this case, House Bill 81, where the process is actually delayed and consent of parents is needed. Sorry. I just really wish that we would rethink. Sorry. I have emotions. To have, especially a minor's life, be in jeopardy when it comes to taking the choice into their own hands instead of going to an actual medical provider, it just seems indecent for the legislator to make that choice for them.
Are there any questions for this witness? Thank you.
My name is Michelle Warren. I also am a minor from Southwest Missouri, and I'd like to speak on behalf of all the minors here in opposition of House Bill 99 because it requires, as you all know, House Bill 99 requires both parents' consent with a few exceptions, but there are several cases in which that's not possible to do that aren't covered within the exceptions of the bill. And if we were to cover every single case, the bill would be longer than I am tall. There's no way to physically cover every point in which it's possible to have a problem with both parents being notified. And as it is, one parent's already required for notification, and as we've had testimony earlier, that is enough for every other medical procedure. I would suggest instead of requiring young women to jump through these extra hoops, we stop the problem where it starts and maybe a more comprehensive sexual education in addition to the abstinence-only education we receive would prevent that problem before it begins. Thank you.
Question for the witness? Representative Lauer.
To inquire, please.
You may.
Thank you. Hi, thank you for taking the time to come up here. I just need to clarify, when you started out, you said that you were in opposition to House Bill 99, is that correct?
Yes.
Okay, so is that, and I just need this to clarify, is that saying that you are not in opposition to 81 or 124?
No, I am not in opposition to all three.
Okay, that's what I need the clarification on, because when you mentioned one bill and we're talking about all three, I just need to make sure. Okay, thank you.
Thank you. Thank you, Michelle.
Hello, my name is Sarah Whelan, and I'm also from Southwest Missouri. I came with a large group of minors, and we all agree, and we're all in opposition of the bills present today. But in regards to House Bill 124, we view this as a way of shaming women. And this isn't okay, because in society today, women already face a whole bunch of issues, as all people do. And when women are forced to watch videos that could be detrimental to their health, their mental health, this is a serious problem. And a lot of people do have mental issues, and that's not well looked upon in society today. And watching these videos could be a trigger to them. This could be a trigger, and that's not something that we want to do. And a lot of thought goes into an abortion. It's not just that someone takes a pregnancy test, they say, oh wow, I'm pregnant, I need an abortion. They think about it. They take time to research it. They think 22-hour waiting period. And having to watch all of these videos and look at all this information they've probably already seen before and are aware of. This is just terrible because it's shaming women. And also, just in general, I'd like to ask a few questions. I'm very pleased with the amount of women in the room today, but
I'm guessing that no one in this room is a woman that has been in a place where she had to consider abortion. And, you know, you've had your rights to your body for every medical procedure you have. And why can't a woman who needs an abortion have the right to her own body?
Thank you, Sarah. Are there any questions for this witness? Thank you.
My name is Dr. Rachel Ziegler, and I'm from Chesterfield, Missouri. I'm a resident physician at Washington University in St. Louis.
Doctor, would you hold up just for You may continue. Thank you very much.
Thank you. I'm here today to discuss specifically the harmful implications of House Bill 99 with regards to the prohibition of safety regulations at pregnancy resource centers. While working a night shift, I received a page from the emergency department regarding a patient they would like me to evaluate. I was told she came in with lower abdominal pain as well as a positive pregnancy test. While discussing her history, I found out that she had an unplanned but desired pregnancy. She stated that she had gone to a pregnancy resource center nearby 1 week prior where an ultrasound was performed. She was told she had a, quote, healthy pregnancy inside the uterus. My ultrasound, however, told a very different story. It showed an empty uterus with a pregnancy in her fallopian tube, known as an ectopic pregnancy. My ultrasound showed a large amount of blood in her pelvis, signaling a ruptured ectopic pregnancy, which is a surgical emergency. As we rushed her to the operating room, she became pale and her vital signs drifted towards unstable. My attending physician and I performed emergent surgery to remove her ectopic pregnancy and stop her life-threatening hemorrhage. After she recovered from surgery, she asked while crying, why would they tell me everything was okay when it wasn't? Why would they tell me something that wasn't true? I wish I could tell you this was a rare occurrence. Pregnancy resource centers are currently not required to provide medically factual information, and this bill would place even fewer restrictions on them. In the case of my patient and the many I have seen just like her, this is a matter of life and death. So, just as my patient asked, I ask you, what happens when they tell her everything is okay when it isn't? Why is it okay for pregnancy resource centers to tell her something that wasn't true? There are currently more than 30 laws regulating physicians that provide abortion, yet House Bill 99 places no regulations on non-physicians practicing medicine. If this isn't backwards, I'm not sure what is.
Very good. Perfect. Came in just under the wire there. Are there any questions for this witness? Thank you so much for your testimony.
Hello, my name is Ann Frissy. I'm a third-year medical student at Washington University School of Medicine and was born and raised in the St. Louis area. I oppose all three of these bills, but will be first speaking to HB 99. In medical school, we are taught to present evidence-based information to our patients. We present them with up-to-date data and let them make their own decisions. It is important that licensed healthcare providers with no personal or organizational agenda present this unbiased information to protect a patient's personal freedoms. A law that prevents regulations on pregnancy resource centers means that we are infringing on individual freedoms and placing women's health, your voters' health, in jeopardy. These resource centers, as was previously discussed, supply patients with sometimes medically inaccurate information and are unregulated. These women use this information to make important decisions about their health and their families. These resource centers should be held to the rigorous standards we demand from all medical organizations and anyone who provides medical care. 1/3 of women in their lifetime will have an abortion. These are the people that you swore to represent. You support their freedoms and their health by not letting these pregnancy resource centers go unchecked and unregulated. In addition, I'd like to speak to HB 124. As I previously discussed, doctors help our patients navigate a sea of complicated medical data. We provide summaries of medical literature, tell you about the risks and benefits associated with every procedure,
and lets you make your own decision. You wouldn't want a corporation like a drug company presenting biased interpretations of medical literature. In that same frame, you don't want the government presenting their interpretations of medical literature. You want someone who is trained to interpret medical literature and supply you with all the facts you need to make personal decisions. Decisions about healthcare should be left to you. This bill could create a precedent for government intrusion into personal health decisions, which I think is a terrible choice. This decision is up to you, your family, any clergy members you'd like to discuss it with, and I don't want the government in my exam room.
Thank you. Are there any questions of this witness? All right. Representative Burnley.
You said 1/3 of women have an abortion
Yes, in their lifetime.
in their lifetime.
Yes, and over half of those women are already mothers.
Where do you get those facts?
They're well-known facts. There's actually a lot of campaigns who are base their name off of this well-known fact called the One in Three campaign. You can look up a lot of these Walker Institute, which is a reputable source for this type of information.
I think in the interest of time, we'll go ahead and proceed with the next witness. Thank you. Thank you for your understanding. Are there any other citizen witnesses? Remember that if you have something that is going to be repetitive, just say, I support, I suppose. Oppose, sorry. How are you?
I'm Stephanie Bradshaw. I just wanted to tell a short story about a friend of mine. She was recently sexually assaulted in the bathroom while we were at a restaurant, and she refused to tell anybody because she felt like she'd be causing unnecessary problems. It's the unnecessary amount of procedures and regulations that go into these kind of claims, whether to do with assault or abortion or anything like this, that cause women to harm themselves, whether emotionally or physically or in any way. And bills such as, thank you, 124 are bills that will shame women away from doing what's best for them, both emotionally and physically.
Are there questions for this witness? Thank you. All right, it looks like we're ready to move forward. All right, so let's see. Oh, do we have one more?
Yeah, I'd like to.
Okay, one more. Thank you.
Hi, my name is Nora Burtis. I'm a medical student at WashU. And I'm against all three bills, but would like to talk about HB 124. A lot of previous people testifying have talked about how they found these videos, or like they have found the informed consent state scripted counseling to be shaming. And I would like to point out that professionalism is one of the most important values in medicine, and it's something as a medical student we're taught to all the time. And it's an essential part of the oath that we took when we entered medical school. And I believe having a video that shames women is unprofessional and against one of the core values of medicine.
Are there questions for this witness? Thank you so much. And do we have any other citizens? Yes. My astute LA has reminded me that anyone that's testified thus far needs to fill out a witness form and leave it on the desk for us. Do we have those? All right, we're going to go back to support. So
from everyone who testified so far.
All right, thank you.
And other people in the room.
All right, so those now that are affiliated with organizations who would like to speak in support of any of the bills, please come forward. How are you?
Madam Chairman, members of the committee, my name is Patricia Spain. I am the Executive Director of Missouri Rights Monitoring.
and I'm here in support of all three bills. I don't have a lot to add to what the sponsors of the bills have said, other than I think we need to, research has been done on medical textbooks prior to the 1990s, and I'm not sure about the exact year, but at some point in time, the definition of pregnancy changed from contraception to implantation. And why that is, you would have to ask people in the medical profession, but it did change. And research has been done on medical textbooks, and prior to that time, there are no, that we have been able to find, medical textbooks that define pregnancy and implantation. You know, we've heard a lot of women talk about the insult of information, the insult that it is to them to be asked to look at additional information or any information, and that is unfortunate. There are many, many women who go in desperate times, in desperate situations, looking for some solutions to abortion clinics, and they don't have the information. We've heard them testify at these hearings for many, many years. And, you know, it is your job, and all of them, and maybe all of our jobs, to try to find some balance and some way to protect the women of this state who don't have that information, so that they don't make a decision that they struggle with and are harmed by for the rest of their lives, you know, emotionally, physically, psychologically. Other than that, I have nothing else to say other than Missouri Right to Life supports these bills, and I'd be welcome to answer questions.
All right. Thank you so much. Committee members, your questions, Representative Neely? You may.
You mentioned several times about when they go to an abortion center, they don't have information. What type of information?
Well, oftentimes they don't know very much of anything. All they know is many times they're not even sure they're pregnant, but you know, they may go there just to find that out. But they may not have researched information. They may not have looked into their options. They may not have looked into medical information, and it happens. It's happened many times. We've heard the testimonies of women that have stated this.
So one of them would be that perhaps these people looking for abortion should go to a pregnancy care center.
No, I'm not saying that necessarily. They just need information.
Thank you.
Any questions from the committee? Thank you so much. Any other in support from an organization? All right, so we'll do lobbyists or people we see frequently at the Capitol.
Thank you, Madam Chair. For the record, Abram Messer with Missouri Family Network, also here today with Americans United for Life. I have already turned in witness forms in favor of all three bills, but I want to focus my testimony this afternoon on House Bill 81. Really focuses on consent. Right now, currently, there are 10 states that require signatures to be notarized. Once those signatures are notarized, it's essentially a guarantee to all the involved parties that those individuals are exactly who they say they are. It makes some slight modifications to our judicial bypass by leaving the judicial bypass intact, recognizing that not every family in Missouri is a perfect family. And also, as it modifies some of those points within our judicial bypass system, what we're doing is we're making sure that all the information that has been gathered up to that point goes to the judge, goes to those officials to help them make a decision. It says that they may refer them to some kind of counseling, which is to be done, or evaluation, which is to be done by the Department of Health. All of those individuals, social workers, etc., those are all mandated reporters. This is not an attempt to shame an individual. This is an attempt to establish whether or not that individual is in fact a victim of a crime, so the perpetrators of that crime can be sought out. Thank you, Madam Chair.
Thank you very much. Any questions? Seeing none? Good afternoon.
Good afternoon, Madam Chair, members of the committee. Samuel Lee with Campaign Live Missouri. To go on record in support of all three bills. First, I want to thank the three sponsors for bringing this legislation forward. This is the second year in a row for them, and for two of these bills, the Missouri House has dealt with them. And just for your new members who don't realize this, but House Bill 99 was approved last year by 116 votes on the House floor, and House Bill 124 was approved by 115 votes, well over 2/3. And I just want to get back to the basics of the bill. There's been a lot of talk about from people who are unhappy with the parental consent laws and are unhappy with the informed consent laws. All these bills do is to build up upon what your predecessors did in order to protect women and unborn children here in the state of Missouri. The bills regarding parental notification and parental involvement build on what has been in the law since the late 1970s and has been upheld by the courts. And I would point out that when it comes to having parents being involved in their minor daughter's decision, Americans overwhelmingly support that. The Gallup poll from 2011 found that 71% of Americans require parental consent, and a more recent poll from this month found that 78% of Americans support parents being notified, including 65% of those who call themselves pro-choice. On House Bill 124, again, this is building upon what is in the law right now. Right now, the legislature required, and the Department of Health has put into effect this informed consent information, and it includes information on her medical health and possible risks, alternatives to abortion, fetal development, a whole range of things that are involved. This is just one additional way to impart that information to the woman. And in order to present to you that this is not my opinion or the sponsor's opinion, I would just refer you to the written testimony that cites a professional textbook that talks about the importance of audiovisual materials. Madam Chair, thank you very much.
Thank you so much. And do the representatives, did you all receive the written testimony? Mm-hmm. Yes.
And Madam Chair, I'll send both copies to your office so you can distribute that any way you see fit.
Thank you so much.
Thank you.
Others in favor?
Madam Chair, members of the committee, Tyler from 5 Missouri Catholic Conference, come on record to support House Bill 99 and 124. Thank you.
Would you either speak up or speak into the mic so that we can have your name for our records?
Good afternoon, Tyler McCluggett, General Counsel, Registered Lobbyist for the Missouri Catholic Conference, going on record in support of House Bill 99 and House Bill 124.
Thank you so much. Any questions from the committee? All right, do we have others in support? We're now ready for, if you're affiliated with an organization or a lobbyist and you would like to testify in opposition of any of the bills, please come forward in 2 minutes. Please tell us the bill numbers. Thank you.
Madam Chair, members of the committee, I'm Pamela Sumners. I'm the Executive Director of NARAL Pro-Choice Missouri, and my background is in constitutional law. So my orientation sort of runs that way. I oppose all of the bills, but I'd like to kind of combine analysis of HB 99 and HR 81 on the parental notification provisions. And I very much appreciate that Representative Miller, in fact, took some of our amendatory language that we conveyed to him in last year's bill through Representatives Curtin and LaFavor, and that now it's a little more sensitive to things like restraining orders and family abuse, which I think is definitely what Representative Newman was looking at. Still and all, it would be a wonderful thing if we could mandate healthy family communications And if everybody got along as well, even after divorce, as Representative Miller seems to have with his family. But in truth, we know that we're not all Ozzy and Harriet. And in fact, we have some parents out there who are more like Ozzy Osbourne biting the heads off bats before he got his reality show. And in reality, we know that there are parents out there who will kick you out of the house. And that's what happened to a young woman named Becky Bell when she disclosed her pregnancy to her parents, and she subsequently committed suicide. This isn't a reality show. This is unfortunately the reality for some people. I wish it weren't. Unfortunately, it is. Just as a matter of sheerly looking at the law, though, when I look at specific provisions of H.R. 81, it is a veiled attack in some instances and a direct attack on the existing judicial bypass law.
Madam, I'm sorry, your 2 minutes have expired.
Oh, goodness.
I
You know, I've
Go
had the 11th Circuit Court of Appeals tell me the same thing, and they're tougher than you are. Thank you.
Thank you. Are there any questions for this witness? Representative Newman. Oh, please come back.
Oh, I'm so sorry.
To inquire, Madam Chair.
You may.
Thank you, Ms. Summers, for your testimony on this. And you mentioned, you touched on the fact of these legislation attempts to mandate healthy families. Can you, with your expertise in constitutional law, can you give us any more background in terms of any privacy standards that we're also up against, and also how do we mandate that perfect communication?
Well, of course you can do that, and if there were a legislative body that could do that, we would have a perfect set of families. But when we look at this as a legal matter, what we're looking at here in at least 5 provisions of H.R. 81 in direct conflict with the judicial bypass laws that exist, which was drafted to conform to what the Supreme Court said we had to have, which is that parents don't have a veto power, an absolute veto power, when it comes to a minor's access to abortion. One of those cases is the Danforth case that came from the state of Missouri. There are actually twin cases. There's Danforth and there's the Bellotti case. They've been there since the 70s. The law as we have it written now provides for a judicial bypass in the event that there is a reason that a parent can't be involved. The court essentially steps in and substitutes judgment. And the court does that in accordance with a very highly specified procedure. There are at least 5 provisions of H.R. 81 that conflict with that. And one of the main things is that the language in here says the court establishes a deadline under this proposed language. We already have a deadline, and a deadline following discretionary procedures on the court's part is not an equitable consideration. Deadlines are deadlines, and lawyers understand deadlines are deadlines.
Thank you.
Are there questions from the committee?
All right. Thank you. Thank you. I've been doing this long enough, you would think I would remember to leave these things here. Thank you so much.
Thank you.
Good afternoon, Madam Chair, members of the committee. My name is Sarah Rossi. I'm the Director of Policy and Advocacy at the ACLU of Missouri. We are opposed to all 3 bills. I'll leave our forms here. I'm going to try to focus, zero in a little bit on the judicial bypass portions of HB 81. And I think something that Ms. Sumner's addressed briefly, which I'd like to go into a little bit more, is that the provisions in HB 81, the proposed provisions, completely obliterate what already exists for judicial bypass. Some of the provisions are similar, but as she said, the timeline has been destabilized, and the fact that there are no set timelines in the new provisions is very troublesome for us. I say that because there are actually attorneys in Missouri who work on judicial bypass issues with girls who are seeking an abortion. Just to put a little bit of perspective on that, it would take
as the judicial bypass law stands right now, it would take about 4 visits to St. Louis in order to get through the judicial bypass system and obtain an abortion. And that goes for everybody in the state of Missouri, as there's probably, as far as I know, 1 clinic that still provides abortions in the state of Missouri, which is in St. Louis. So you have travel across the state 4 different times. So when you take into account that a young girl is going to have to figure out how to get out of school, find a ride, find gas money, do all those things 4 different times to get to the city of St. Louis to go through the judicial bypass system, that's a little terrifying. One of the other issues we have is that this new system of judicial bypass requires that the minor petition a court in the county in which they reside. So when you think about that, not only is she going to have to go all the way to St. Louis, be told by Planned Parenthood that she has to get her parents' consent or go through judicial bypass, then she goes all the way home, tries to find an attorney in her own county to help her through the judicial bypass system in that county, which I think we all know is kind of a far-fetched goal, especially in some of the more rural, more conservative areas of Missouri. And then she has to go all the way back to St. Louis to find an attorney there. Luckily, she probably will be able to find one because there are people who are willing to do that work. And then she has to work with that attorney, and that adds another trip on. So what we're talking about in HB 81 isn't just consent issues. We're talking about consent issues that are backed up by a judicial bypass system, a new judicial bypass system that's exponentially more difficult than the old judicial bypass system. Other than those 4 trips, she's also going to have to deal.
Sorry, your time is expired. Thank you so much. Are there questions for this witness? Representative Newman.
Oh, sorry, Representative.
Thank you to the choir, Madam Chair. Ms. Rossi, you touched on this, and you really explained what would happen if this became law in terms of HB 81 became law, and how a minor would actually have to go through the system to obtain that legal abortion. What do you believe is the actual intent of House Bill 81?
I think the actual intent of House Bill 81 is to delay and prevent a perfectly legal medical procedure that every woman and young girl in Missouri has a constitutional right to obtain.
So by doing that, by delaying it, by shaming, by putting more obstacles in front of a safe legal procedure that she's actually entitled to, what that's doing is adding that extra layer. Are we mandating as a legislature? Are we with these bills, actually all 3, are we trying to mandate a certain religious viewpoint in terms of what we are putting into statute in terms of what women would be in under these situations?
I don't really want to speak to that. I think that religious viewpoints, obviously we're the ACLU, we're fans of free speech in every context on every subject. I think the fact of the matter is that accessing abortion is a constitutional right. It's a legal right that all women and young girls have. And to try to deter somebody from exercising that right is an infringement on the Constitution of the United States and the Constitution of the state of Missouri.
Thank you.
Other questions? Thank you so much.
Thank you.
Others? Thank you.
Thank you, and I will try to be brief given how much time you've given everyone. I really appreciate it. Thank you, Madam Chair, committee. My name is Mebby Mead, and I am the Director of Organizing for Planned Parenthood Advocates in Missouri, and we represent the Planned Parenthood affiliates, and I've submitted my testimony, so I just wanted to go over a few brief points. As a provider of reproductive health care, a leading provider of reproductive health and sexual education information in this state, Planned Parenthood is committed to providing services in the most safe and healthy environment as possible. We are accredited through a rigorous national process and believe in an evidence-based approach to all of our ways of delivering services. Unfortunately, these laws, as well as other laws that are on the books, and it has been addressed by medical professionals as well as teens and other experts, the bills mandate providers of these services to not follow evidence-based procedure, and in fact, follow procedures that have an intent of either coercing, stopping access to the procedure, or making the woman seeking the services or her family feel shame. And those aren't evidence-based inputs that should go into top-notch medical care in the state. So as a provider, we Some of the students mentioned sex education. I think Representative Newman has a number of bills, as does Representative Monticello and others, that provide policy solutions in this area. We would love to work on those for the benefit of the children and families of Missouri. And with that, I'll take any questions that people may have. And again, I know time is short. Thank you for hearing us all out.
Thank you so much. Are there questions for this witness? All right, thank you so much.
Thank you.
Representative, did you have a question? No? All right, good. Others that would like to testify in opposition? Okay, we're going to go there. This is the slave driver next to me here. All right, is there anyone here today to speak for informational purposes only on House Bill 81, House Bill 99, or House Bill 124? Seeing no further witnesses, I do want to thank the committee members, everyone in attendance. Thank you so much.